Hello and welcome to another episode of Keeping London Healthy. I'm Dr. Mario Elia. We're happy to be joined today and excited to bring on Dr. Alex Summers, our Medical Officer of Health here in London at the Health Unit, who's going to talk to us all about all the things that the Health Unit does. I know during COVID, obviously, we got to know Dr. Summers quite well and heard from him regularly about COVID and COVID vaccinations and where we're kind of headed with the pandemic. But I think now we're kind of in a different stage of the pandemic. It's important to kind of reconnect and find out all about the other things the Health Unit does and how it can benefit us as a community and what patients need to know. So again, we're happy to be joined by Dr. Summers today, and we'll bring Dr. Summers on right after this message. All right, welcome back. Again, we're pleased to be joined today by Dr. Alex Summers, our Medical Officer of Health here at the Middlesex-London Health Unit. Thanks for joining us today, Dr. Summers.
Great to be with you. Thanks for having me.
Again, what sparked my request to have you on today was that I was sitting in my office looking up something on the Health Unit's website for a patient and realizing the depth of stuff on there and how much the Health Unit truly does. And then I looked over to my bookshelf, and patients probably won't know this, but family doctors every year are given a binder of resources that the Health Unit provides. And you guys can see that at home. There is a ton of stuff that the Health Unit provides. And I think kind of as we come out of COVID, and I know obviously people, we're hearing lots from the Health Unit around vaccination and policies around COVID. As we're kind of transitioning away from that a bit, I thought it'd be useful to bring you on to tell us all about what the Health Unit offers and what patients need to know. So again, thanks for coming on today.
Glad to be with you. There is so much that we do at the Health Unit, and to have the opportunity to speak about it is a real privilege for me. So thank you.
So the first thing we'll touch on, again, I mentioned we're kind of coming out of the intensity of COVID, but I think it's helpful just to talk really quickly about COVID vaccination, because we're still getting some questions about that from patients in terms of, who should be getting boosters, what ages, at what frequency. So I just wanted to kind of ask you quickly, what's the message to patients that they need to know about vaccination right now for COVID?
Being up to date with your COVID vaccine continues to be one of the most important things you can do to protect yourself as we move from a pandemic state to an endemic state. When I say endemic, it means that COVID is now normal in our community, but we still want to reduce the severity of impact that it has on our health and the health of our community. The key thing for COVID vaccination right now, as we sit here in the spring or approaching the spring of 2023, is that we want everybody who certainly is an adult and most teenagers and children as well to have had a booster dose for the COVID vaccine at some point during the fall. That booster dose is critical to providing some additional protection against the variants that are circulating in our community, as well as boosting the immunity that people may have had waning since they would have last been vaccinated. So for most folks, if you had a booster dose in the fall, you're good. However, we are also anticipating that an additional booster dose will become available shortly for higher risk individuals in our community. We heard from the National Advisory Committee on Immunization late last week that they will be advising an additional booster dose for people who are over the ages of 65 or who have other medical comorbidities. We're waiting to get more details on that, but I anticipate that for folks that are more vulnerable, we'll see an additional booster dose available to you starting sometime later this month and through the spring. For everybody else, I would look ahead to the fall, where it is likely that you will again be eligible for another COVID-19 booster.
Personal experience here in the practice for those vulnerable groups, 65 plus, and those with comorbidities. I've even had some patients hospitalized probably the last few months who've been kind of outside that 6-month window, who've maybe not gotten their booster dose and hospitalized. Thankfully, they've, in my practice, they've recovered, but again, kind of a lengthier hospitalization and probably preventable if they've gotten those booster doses. So very helpful advice there. Around the topic of immunization, I know a lot would have heard this in the news with school-age children who were getting letters about not being up to date on their vaccinations and encouraged to follow up with their family docs. Can you speak a little bit about this, how things are going in terms of kids getting those booster doses that they require for school, and whether there's been a good uptake on that and what parents need to know?
In Ontario, all secondary and elementary school children are required to either be up to date with 9 specific vaccine antigens or have submitted an eligible exemption to their local public health unit. So since the pandemic ended, or has been starting to at least end, The health unit has been checking out the records for each student in elementary and secondary schools in order to assess whether or not there's an exemption on file, or ideally, the student is up to date with all their vaccines. For those kids with records that aren't completely up to date, we've been sending out reminder letters over the last year, making sure people are aware that they need to update their record with us at the health unit. And in the last couple of months, we've actually been rolling out suspension notices for kids whose records remain not up to date. So if you're a parent and you're receiving a letter in the mail saying, hey, my kid is about to get suspended because they're not up to date with their vaccine, I've got good news. We can solve this problem together. In order to make sure you're up to date and to make sure that your child's records are up to date, you simply have to submit the vaccination records that you have to the health unit. And you can do that online at our health unit website, healthunit.com, or in person at our City Plaza site in downtown London. We are also available by phone to help answer any questions you have about your vaccine records. And of course, you can follow up with your family physician, nurse practitioner, or healthcare provider to also review your records with them. The key thing to note is that the records from your healthcare provider's office are not automatically submitted to us at the health unit. As a parent or guardian of a kid, that's up to you to do. It's really easy, but it is up for you to do. And so make sure you take those records and submit them online or in person.
Very helpful advice. I know we've been getting a lot of worried calls from parents who weren't aware that they assume that we would forward it automatically to the health unit, which we don't, and the fear that is my kid actually behind on these vaccines? By and large, most kids have been up to date. It's just a matter of getting those records sent over. Also helpful on the health unit website for parents who are wondering, is my kid up to date on their grade 7 shots? Do they need any ones through high school? The health unit's website does allow you to log in there, and it'll actually tell you what, if they have other shots coming up. So very, very helpful for parents to get on that website, especially for those grade 7 shots, eligible until the end of high school for by and large for those. So for kids in grade 12, good opportunity to get on there and check just to make sure they're up to date. We'll transition a little bit over to dental health, which I know is something that maybe patients don't think about as commonly as the health unit being involved with, but there are some very helpful programs that I know the health unit does run. Now, I guess we'll start with the Healthy Smiles Ontario program, if you can tell us a little bit about that.
Healthy Smiles Ontario program is a free preventive dental service that the health unit provides to children and youth 17 years of age and under from households of lower income. It's a service that ensures that kids are getting routine examinations, preventive services, fillings, etc., as well as appropriate referrals for additional dental services if necessary. Oral health is part of health. If you have oral disease, that can impact illness throughout the body. It can also impact attention in school. It can impact confidence. It can impact a lot of different things. And so the Healthy Smiles Ontario program is really about ensuring that everybody's, particularly in their children years, is receiving the dental care and services that they require. If you're not able to access dental services for your child and you're looking for options, please give the health unit a call so that we can work with you to see what we can provide and make sure is available to your child.
And that'll be a running theme through the whole episode today, is that if any questions, call the health unit, because again, there are so many good resources that, even if, you can't find it on the website, call the health unit. The staff there are, I'm sure, more than happy to help and direct you to where in the community things are available. And if the health unit can't necessarily help directly, they can navigate towards other community resources. Staying with dental health for seniors, I know there's a newer program available for the Ontario Seniors Dental Care Program. Tell us a little bit about eligibility and kind of who should be looking at that kind of program, if you can.
In the last number of years, the provincial government has expanded access for seniors to oral health programs. So through the health unit, we provide or refer individuals who are eligible for the seniors dental program for services. And these are folks who are seniors who don't have access through insurance programs or otherwise to the appropriate dental services to make sure that they are aging well. The eligibility criteria is listed on our website, but generally speaking, what we refer to is people who are seniors who otherwise don't have access to dental services through insurance programs, etc. You can apply for the program online in order to see if you're eligible or not. And if you are, you then enter into the program where you either receive services directly here through the health unit or through one of our contracted service providers.
Two other programs that I know the health unit's involved with. One, the school-based screening, which I actually didn't actually know was happening. It was actually interesting for me to read about this. And then the fluoride varnish program. If you can just chat about those two programs.
Healthy Smiles Ontario, the school screening program, and the fluoride varnish program all go hand in hand as the layered approach that we take to ensure that kids have healthy teeth. The school screening program is done in elementary schools in order to assess whether or not there's any dental issues for children. We identify it and then help to facilitate referral or screening through a dentist, either through the Healthy Smiles Ontario program or through a parent or guardian's dental provider. The fluoride varnish program is part and parcel with that as a way of ensuring that we are protecting people's teeth. Fluoride, as everyone knows, is a really critical part of strengthening teeth and making sure that they remain healthy. And that can be delivered either through our drinking water here in London, but also through the fluoride varnish program. Again, all part of the layered approach to ensuring that kids' teeth remain healthy.
And thankfully, our anti-fluoridation groups in London have been relatively quiet for the last number of years, and hopefully they stay that way. Transition over to newborn health and early child health. I know that's something that the health unit for many years has been a critical role for the health unit. Prenatal classes we'll start with. So I know, back many years ago, for some of us who went through kind of the old prenatal classes, the in-person classes, where parents would attend and over a day or two would get some education. I know there's been some changes around that for parents. If you can kind of speak to a bit about how do new parents get their prenatal education these days?
Yes, if you backtrack 25, 30 years, prenatal classes were part and parcel with the parental experience of getting ready to welcome home your child. In recent years, much of the prenatal programs have been moved online, recognizing that that's a medium that many parents and anticipating parents appreciate and value. There are still, not necessarily through the health unit, prenatal in-person classes available in the region at a bit of a cost, but we also provide prenatal supports, particularly for low-income families or more vulnerable communities. The focus for us is really on more vulnerable equity-seeking groups because we know that those groups may not have the same access to prenatal supports that others in our community do. And so we want to make sure that those services are available there.
For especially new moms for breastfeeding support, I know the health unit does provide some resources there, both telephone and home visits. How does someone get in touch with the health unit around those, and who might be eligible?
Individuals can self-refer to the health unit for breastfeeding support by calling our number at 519-663-5317. If you're having challenges with breastfeeding, or if you have questions, and we can either arrange to chat with you by phone, we can direct you to some of the resources, again, that are available in a variety of different ways online, or if things are really required, and we may be able to arrange some in-person support as well. Again, this really speaks to the fact that public health is now delivered in a multitude of ways. We used to deliver it all one single way, and it was always in person all the time. But what we recognize is that that's not always the best way to reach people. So there's different ways to provide those services now. But again, I would direct you to give us a phone call, check us out online, because there's lots of different provincial services available to you depending on your needs.
One more question around kind of child and parent health, and this is actually one of the things that prompted me to bring you on, was to explain the differences between a few of the programs, because I know there's the Smart Start for Babies program and the Healthy Babies, Healthy Children program, the Nurse Family Partnership. Can you speak to a little bit of the differences and kind of who would access which programs, and again, kind of what the distinction is, and who would benefit from what program?
Those first couple of years for a kid are so critical, and that's why we really focus on supporting parents in those first few years with their children. We have a variety of programs that help people depending on their needs. When a child is born in the Middlesex-London region, every child is screened to assess what their potential needs might be. For some, there is a program called the Nurse Family Partnership Program, which is a very intensive program for young first-time mothers. And ideally, we actually want to start working with those mothers before delivery, so during their pregnancy. And that's why we rely on healthcare providers to refer potential eligible mothers, first time and young, to us at the health unit so we can work with them through our Nurse Family Partnership Program. So it's a really intensive home visiting program delivered by nurses. The Healthy Babies, Healthy Children program is also delivered by nurses. It's a little bit less intense, but it's a home visiting program for mothers and dads and parents that might need a little bit more support. Again, backtrack 25 years, every single mother and father that gave birth to a child received a home visit from a public health nurse. We recognize that not every parent needs that. If you are on your third or fourth kid, you've done the parenting thing before, you may not need a home visit from a nurse. On the other hand, if you're young, if it's a first child for you and you've got some other social pressures, you might. And that's where the Healthy Babies, Healthy Children program kicks in. So again, there is home visiting programs delivered in the form of Nurse Family Partnership and the Healthy Babies, Healthy Children program. And they're delivered at different intensities for different people depending on their needs. And we really assess that at birth or through referral from a family physician. The Smart Start for Babies program is a group program. So it's not a home visiting program. It's a group program that is really targeted at parents who are looking for some additional skills in order to prepare for their child or to help with those first few programs. Some of our programs are delivered through our community centers here in Middlesex and London, with a focus, again, on parents that might need a little bit more support in order to prepare for the arrival of their child or through those first few months.
And for those watching at home, even for those who are not necessarily planning on being parents, but maybe someone who just knows somebody who is about to go through this process, referral to these programs are really dependent on your healthcare provider knowing about these programs. And it's a really, I'll admit, it's a source of inequity in the community, and you're basically dependent on the quality of your healthcare provider and who knows about what. So even for those of you watching, if you know somebody who is about to embark on the journey of parenthood, you don't necessarily need to know the different distinction between these programs that we just talked about. But even encouraging that person who you may know may have some challenges with parenting or may benefit from some additional resources, have them call the health unit, have them get connected, because again, we don't want them necessarily dependent on their OB or their family doc or their pediatrician kind of knowing about these programs, because again, sometimes these programs are in flux, as Dr. Summers will tell you, and then the names change and they don't, but ultimately just knowing that these programs will exist, and to contact the health unit to get connected.
I really appreciate that message because it's critical. If you want some information, if you're looking for some help, reach out to the health unit. We will figure out a way to support you in the ways that you might need. We really do try and make sure that we're at least assessing every child that's born through the screening that happens at delivery in the hospital. But if you're looking for additional support, reach out, let us know so that we can talk to you a little bit about what the options might be for you. And again, you can always check out our website if you have that available to you.
We're going to take a quick break and we'll be back after this message with more with Dr. Summers. Welcome back. We're joined today by Dr. Alex Summers from the Middlesex-London Health Unit. So we'll move on to some issues related to sexual health, which again has long been part of the role of the health unit here locally. Can you tell us again, for those who maybe haven't gone through their teen / early adult years and maybe aren't aware of what the health unit can offer, tell us a little bit about the clinics and offerings of the health unit from a sexual health perspective.
Sexual health is a critical part of health. And one of the things that we are always mindful of is the risk of sexually transmitted infections. In Middlesex-London, as well as across the province of Ontario, certain STIs are rising with regards to how prevalent they are in our community, specifically chlamydia, gonorrhea, and syphilis. So it's really important that we have supports available for people to protect themselves, to reduce transmission, as well as to make sure that they are otherwise enjoying good sexual health. That's really, really important. So here at the health unit, we provide sexual health services in a variety of ways. We provide it through our work in our early years programming. We provide it through our work in our schools, but we also provide some clinical services as well. The health unit has STI clinics Monday evenings, Wednesday evenings, and Friday mornings. And that's an opportunity for people who want to remain anonymous or who are looking for more of a walk-in, appointment-based type of clinical opportunity to come and get assessed. That can include opportunities to be screened if you don't have any symptoms, or if you've got some symptoms you want to have taken a look at, we can provide anonymous access in order for you to see those services. So those have been going on for many years and continue to be offered. We also have family planning clinics, which are low barrier clinics for people that don't have access to primary care otherwise, to access birth control and other family planning options. So that clinic also operates here at the health unit. The last thing that we do offer as well is at-cost birth control for those that have a prescription but are looking for a place to fill it cheaply. You can visit us at the City Plaza location in downtown London in order to access those medications at cost. So lots of different ways to, again, utilize our sexual health services here at the health unit. Healthy sexuality is an absolutely critical part of people's lives, and we hope that those services help people achieve that.
Sharing that message about the at-cost contraceptive options for those of you, for those in your life who may be not aware. Obviously, with the OHIP covered program for those under 25 for meds, that's taken some burden off in terms of making contraceptives more affordable. But for those 25 and over who may not be aware of the clinic, again, making sure we spread the word on that. Things like IUDs, if someone tries to buy a Mirena, you've heard of, or a Kylena, which are quite expensive, $400, $500. A copper IUD through the health unit really can be as cheap as even $50. So sometimes a good option for people there. And obviously STI, STI rates in the community, unfortunately, are going up. Whether COVID obviously playing a role there, and women, only have to go for PAPs every 3 years as opposed to every year. So we're less opportunities to screen. So definitely making sure we're keeping up to date on that. A couple other kind of quick things. One is around tick surveillance. Obviously, it's not quite tick season yet as we look outside, but as we hit the spring, we're going to start seeing more ticks in the community, more tick bites. Some guidance around, when do ticks need to be brought to the attention of healthcare providers and the health unit? Some kind of messaging out there that every tick needs to be screened versus only specific ones. What's your message for people? When does the health unit want to be seeing people's ticks?
We're happy to see ticks at any point in time. Certainly, the key message in all of this is that ticks can be a transmitter of Lyme disease. And I think that's the key focus for folks, is that Lyme disease is now prevalent in the Middlesex-London region. And so if you have a tick that's been on your body for potentially more than 24 hours, that's a tick that you need to pay attention to because of the potential risk of transmission if it is, in fact, the type of tick that transmits Lyme disease. You can bring it to the health unit. We can help identify it, or you can use one of the apps. We link to that online to help identify it, and speak to your healthcare provider about whether or not you need post-exposure prophylaxis. In other words, medications to treat potential Lyme disease exposure. And that's what has changed over the last decade. A decade ago, Lyme disease wasn't endemic. It wasn't universally present here in the Middlesex-London region. Because of climate change and the ongoing migration of ticks into our region, of black-legged ticks, the potential for Lyme disease transmission remains. We continue to do ongoing surveillance in our community. The reason that we would receive your tick is to help potentially identify it for your healthcare provider. But the key thing right now is if you were bitten by a tick, it's been an extended period of time, that's really an indication to visit your healthcare provider and get treated for post-exposure prophylaxis for Lyme disease. We continue to work with healthcare providers to raise awareness about the need to treat proactively for Lyme disease, because again, it is a different landscape than it was a decade ago here in Middlesex and London.
Absolutely. Even my own practice, I remember, 10 years ago was rarely seeing any tick bites at all. And this, last couple of years, at least one a week would come in. And that 24-hour window is really important. Knowing that if the tick has been on you and you're confident that it's been on you for less than 24 hours, risk of Lyme disease is essentially 0%. But if there's a possibility that it's been on you for more than 24 hours, making sure that you do see a healthcare provider. Amazing. Great. Thanks for all this great information, Dr. Summers. So much information for people to digest. And again, if people want to get in touch with the health unit, what's the best way to get in touch with them?
A couple of ways to reach out to us. Obviously, you can visit our website at any time at healthunit.com. If you've got questions, you can email health@mlhu.on.ca or give our phone number a call at 519-663-5317. All of those ways are ways to get that good information that can help you figure out how we can support you and your health.
Thanks again to Dr. Alex Summers for joining us today and providing us all that incredibly useful information about what the health unit can offer us here in our community. And again, the contact information is available on the screen at healthunit.com, and you can call them as well. And until next time, stay healthy.